Familiar faces. The recording is now in progress. So it's so great to see so many familiar faces on this call and some new faces as well. If everyone could just take a moment to write your name and affiliation into the chat, that would be great. So we just know who's in the room. So go ahead and add your name and your affiliation when you're ready. And thank you also to our roundtable participants for joining us today. I see Noelle and Meredith and Kim and Kimberly. Welcome. Great. Thank you for adding your information into the chat so we know who is here in the room. Excellent. Wow. So fantastic to see so many different organizations represented. This is just fantastic to have such a strong turnout at the beginning of the year. So I think we're going to go ahead and just share some slides to just briefly go over why we have this group, the purpose of bringing everyone together, and then we'll dive right into today's topic, which is all about resources currently available for caregivers, because we have continued to hear from both clients in the community, but also from all of you that more resources, more information, more services are needed for caregivers. And so this is our chance to come together and hear what's available. Great. So if you haven't done it already, please do put your name and affiliation into the chat so we know who's here. But again, today's Zoom meeting is a chance for us to get together as providers and as caregivers of older adults or people with disabilities. It's a chance for us to learn about what's available in the community. And we're just really excited that all of you are here. So put your name and affiliation into the chat, and then Bistra, you can keep going forward. So just to go over today's agenda, we're going to do, again, just a brief welcome. If you have an update to share, this is the point in the agenda where we do encourage you to put something in the chat. Maybe there is an event coming up that you want other organizations or people to know about. Maybe there's a resource available that you want to make sure is shared more broadly. So please put it into the chat. And if we don't get a chance to talk about it in today's meeting, we will also include it in the follow-up email after today's exchange meeting. So putting it in the chat is a great place to have a record so that we can also include it in our follow-up email afterwards to all of you. But today's topic is going to be Caregiver Resources Roundtable. So we're going to hear from a few different organizations about what is available, and that's going to be the bulk of our gathering today. And then, as always, we're going to allow for time for each of you to join into a breakout room. And this is a chance for you to network and connect with colleagues, either on a particular topic or question that we have posed today, or maybe, again, there's something that you want to share more broadly with that networking group. So that is our agenda today. And just to give you a little bit more background about the exchange, we put this together last spring, and it was really an experiment to see if providers and those in the community that work on behalf of older adults wanted to come together for a chance for us to, again, share resources, information, services, and potential partnerships and collaborations that are out there. Because we, as your local area agency on aging, really want to do a good job shepherding information that's available and also bringing us together on behalf of the clients. So we meet regularly, this group, to build connections, share resources and information, combine our efforts, align services for greater impact. And of course, we do that as each and every one of you is working day in and day out with our population. So thank you. And again, if you haven't already, put your name and affiliation into the chat. And if you have an update or something to share with the group, this is also a great place to put it in the chat, and then we will send it in the follow-up email afterwards. So with that, I'm going to move to our Caregiver Resources Roundtable. We're really excited to have Noelle Bonham with us from AARP, also have Jill Carney from the Alzheimer's Association, Meredith Anderson from Southern Maine Agency on Aging, and Kimberly and Kim, who are both community liaisons with Hospice of Southern Maine. So thank you to each of you for joining us. The format is going to be that we're going to ask each of these participants to share a little bit about what is currently available for caregivers that they want you to know about. And then after each of them has spoken for about 3 to 4 minutes, we will open it up to question and answer from all of you. So if you have a question, you're welcome to put it in the chat, and we'll bring that up when it's time for the Q&A. But without further ado, I would love to introduce and welcome Noelle. Thanks for joining us, Noelle, and you might have to go off mute so we can all hear you, and we can stop sharing the screen too. Thanks, Beastrice.
Thank you very much. I'm really excited to be here, and thank you for including us. If it is okay with the other panelists, I would like to be the last one to go because we don't do as much direct caregiving or provide services, but we have a whole bunch of resources for providers that we have in terms of research and data and stuff like that. So if it's okay with the other panelists, I'd like to go after they do.
No problem. Thanks so much, Noelle.
Thank you.
That's fantastic. Let's see. Is Jill ready and available?
Yes, I'm here.
Yay, there she is. Welcome, Jill.
Hi, everyone. So my name is Jill Carney. I'm the Director of Public Policy for the Alzheimer's Association Maine chapter. I'm actually filling in for my colleague who most of our office has gone out to a volunteer conference out in San Diego. So I'm pinch hitting for her. So we do offer caregiver resources if you're a caregiver. And I'll pop in some links to the chat just after, I speak. But if you go to our website, which is alz.org/Maine, we have all of our current support groups listed online, and they're both virtual and in person, and kind of all across the state. And you can see kind of the broad offerings that we support. It's somewhere around 25 support groups that we offer, and some of them are focused on people living with dementia. Many are focused on caregivers. Some even focused on folks who have early onset dementia. And so there really is a nice range of support services there. And that's kind of a good, first place to start for Maine support services. We also wanted to flag, we also have a 24/7 helpline that's available, and it's staffed with master's level clinicians that can talk about any kind of issue or question you may have, whether it's, first thing in the morning or in the middle of the night. And so I will again post this, but it's 800-272-3900. And that is a great resource as well for any sort of questions you may have. And finally, or I should say, in addition to the support groups, if you're a provider or affiliated with an organization, we also do trainings and education, and those can be. We have a core curriculum that we follow, but we can also tailor the education that we deliver to your particular organization's needs. So if there is any interest in having us come in and talk about a particular issue, whether it be for a half an hour or 2 hours, we can really feel free to reach out to us, and we can talk about what your needs may be and how we can help, meet those needs. And then, so finally, I did want to mention 2 upcoming virtual conferences that we have. And I don't have these up on my memorized, but I believe February 3rd and 4th, we have a family caregivers conference that's virtual, and it's run by our Massachusetts, New Hampshire chapter, which is kind of our regional lead for all the Alzheimer's Association chapters in New England. And so that's a New England family caregiver conference. It is, there are some Spanish speaking sessions as well, but there's really great resources, and it's 2 days online, and a lot of great resources there. And again, for those of you kind of on the professional side of things, we also have a professional conference, which again is online, virtual, and that is April 3rd and 4th this year. And again, I will pop in some links, and if anyone has any questions to my colleague, Amy Angelo, who wasn't able to be here, is a good starting point. I'll put her email in there. I tend to work on our public policy efforts, also relating to caregivers and making sure that we're increasing support at the state government and the federal government level.
Thank you so much, Jill. That was great. And we look forward to all of those resources in the chat as well, so that we can send them afterwards to everyone as follow-up. And again, we'll do updates from all 4 organizations, and then we'll take questions and answers. So Kimberly Mann and your colleague, Kim, I wanted to see if you would be willing to do the next round.
Sure, absolutely. Thanks, Megan. My name is Kimberly Mann, and I am a community liaison covering mostly York County for Hospice of Southern Maine. And my colleague, Kim Crable, in the same role, covering mostly Cumberland County. And so we'll just tell you a little bit. We are a nonprofit hospice agency working and covering Cumberland and York counties primarily. And we offer services to patients, almost about 250 patients daily that are on service with us. So we like to focus on making sure that our patients and families have all the support that they need from all the various disciplines and areas that we can give them support, not just in nursing support, but also in other areas like social work, seeing chaplains, and getting all of those extra supports sort of pulled together for them. So I'll just take a minute and let you know we offer informationals to our patients and their families. And we have a booklet that we've put together, which will be hard to see, but we'll enter some information later, that walks families and caregivers through the hospice program and services, what they can expect. And this is a really nice resource for people. And I will, of course, say that while we're talking about caregiver services today, we are primarily a hospice agency. So the services that we're focusing on are catered toward end of life, but we also do offer some services to patients prior to that. We have a program called Caring Comfort, and we have a brochure available if you want to get your hands on this. And I know that Southern Maine Agency on Aging has a few of these at their offices in Biddeford. This program is focused on providing a little extra support to patients and families before they actually officially come on services with a hospice agency with us. And this is a volunteer-based program that provides assistance to the family wherever they live. And it's primarily through volunteers, but we do also offer access to social workers and chaplains when it's needed. So it's a really nice program to help people before they're officially qualified for end-of-life hospice services. We also have bereavement services available, and we've been doing some training recently where we have been talking a lot about grief with the community and giving some education on grief. And one of the areas of grief that we've been talking about is anticipatory grief. So grief that's experienced before a loss. And I think this is something that a lot of people struggle with. So we would like people to know that they can access community bereavement services from us even before you have someone on service, or before loss. And there are a couple of ways, we'll enter these into the chat later to connect with our bereavement services, but it would be bereavement@hospiceofsouthernmaine.org. And then we'll provide you with a phone number as well. But that's free programming, again, both the bereavement services and also the Care and Comfort program. Those are free and available to anyone that would like to access them. We have listed on our website as well, and my colleague is going to talk about our community education program for Ask the Experts next. But on that website, you'll find a recording that we did on caring for the caregiver. And it's a really nice recording with one of our experts. And listed under that, you'll find a really nice two-sided page of resources that we provided. And these can be shared with families. They can be shared with people who are actually caregiving right now. And there are some books listed that are favorites of some of our social work staff here. So a really nice list of reading materials, as well as some information on online virtual support groups, which I think might interest people who are currently caregivers and would like support in that community among other caregivers. So we'll provide this to you as well. And I'll turn it over to Kim quickly to talk about that program.
So thank you. My name is Kim Crable. And one of the things I wanted to mention is that one of our big pushes at Hospice of Southern Maine is community education, because there is so much fear about end of life and what's that going to look like. And people think of hospice as for the last, several days of life. And one of our goals is to make hospice care used more frequently and longer for people in our community, because it's such a benefit to the caregivers as well as to the patient. So one of the things that we've done during the time that we couldn't get out during the pandemic is to create an online webinar series called Ask the Experts. We've been doing this for about 1.5 years, and we have 17 captured webinars on our website, askhospiceexperts.org. A few of those which are right up the alley of talking with caregivers about resources. The one that Kimberly mentioned, Caring for the Caregiver. We have one on end of life care planning, which is really important for these people. Some resources they should be thinking about. A guide to having conversations at end of life. We've got a few of those done, one from a chaplain's point of view, and also one from a clinician's point of view, how to have those difficult conversations when someone does have a serious illness. And then we've got a really nice one. People who are familiar with hospice, and some of the rest of you are probably familiar with Barbara Karn's book, Gone From My Sight, which basically describes the final months of a patient's life when they have a serious illness. And we were lucky enough to have her on one of our webinars. We have a lovely conversation with her, and she talks a lot about caregiving and support for caregivers. We're also going to have her back this fall for another program with us. So if you haven't or aren't familiar with this program, if you go to our website, hospiceofsouthernmaine.org, you can find Ask the Experts. You can sign up and be alerted when we do have these. We are having an event February 23rd called Advanced Care Planning. It's going to be an hour, which is also great for this audience, talking about DNRs, living wills, other things to get people prepared. So all their, so they've thought about end of life and what their final wishes would be and how they want that to play out. So I encourage you to sign up for that, because there's a lot of great information there. One other thing that we do, and for some of your organizations that this might be a great thing, we have a virtual reality program, a training program that's about 40 minutes. We have 4 setups for it, and it's called the Clay Lab, and it has you embody through virtual reality Clay Crowder, who's a 66-year-old Vietnam vet with terminal lung cancer. You become him, and you see in 3 different modules how he gets referred to hospice, then he has a fall and goes into the hospital, what that looks like, and then his end of life experience. So it's really a wonderful thing for caregivers, people who are working with caregivers to go through. So I'd like to offer that to this group. If anyone's interested in finding out more about that, we'll share information with you.
Yeah, and it's really interesting also, if you're interested in hospice services are providing care for caregivers. That's really what we do for caregivers and the patient. And it's important to keep that in mind. It's not just about the patient. Anybody can refer. And so in order to get someone or from our organization to come talk to you, it's as simple as picking up the phone and calling us, and we'll provide that number. But we can come talk with you about what's available and whether or not it would meet your needs or help you. And I will close by just saying this. We've been talking a lot here about wanting more people to have access to hospice services and support in Maine. And we've done a tremendous job. In the past 20 years, Maine went from being ranked number 51 nationally to number 13 in 20 years for the number of residents of the state who are accessing hospice services. That's tremendous. And that's because of the work that all of you are doing and other hospice agencies to make sure people have support and services. So we want to just continue moving the dial and helping people get the care that they need. So thanks.
Thanks so much, Kimberly and Kim. And I can see that some questions are starting to come in, so we will save those for after all 4 of our roundtable participants have gone. And if you've joined us in just the last few minutes, please do drop your name and affiliation into the chat so that we know who's here. And we are talking with our caregiver roundtable participants today to know what resources are currently available. And we know that the pandemic really only magnified so many of the challenges that our community is facing. And so this is a chance for us as providers and those who care for older adults or who are caregivers ourselves to know what's available. So with that, Meredith Anderson is joining us today, and Meredith is our Community Services Outreach Manager at Southern Maine Agency on Aging.
Hi, thanks so much, Megan. And thanks so much for everyone being here. I was really humbled when I looked all around the Zoom and seeing all of you here and the experience that you all have. So good to see you all. And I'd like to do the first thing is to give a shout out to Lori Campbell and to Robin. They can give a wave because I was just thinking about it, like between the 2 of them, they have over 50 years of experience. And so sorry, Lori's like, don't say that. They are talking to caregivers every day for many years through Southern Maine Agency on Aging. And I'm just so grateful for all the support that they provide and the resources that they provide. And I appreciate a comment, I think, that Jessica put in the chat about difficulty, like people being in crisis and then needing the support. And as we know, with services and resources being limited, that I know Lori and Robin are always encouraging people to do things as early as they can, as soon as they can, to get themselves on wait lists, because there's waits for home care staffing to be available or waits for assisted living or nursing home beds. So I know they talk about that a lot. So Robin and Lori, and also Becky Hadieris is the family caregiver coordinator. So you might run into one of those 3 at SMA. She's out sick today, as I'm sure a lot of you have run into that may They provide information and resources to caregivers and talk about what their options might be as somebody may need care. They're providing support groups to caregivers and education classes and respite care. And so I wanted to talk some about the respite care, because there's 2 programs now. We had 1 program in caregiver respite, and then there was a second one this year. So for in the traditional, I shouldn't say traditional, but the original caregiver respite program, somebody could get up to almost $5,000, so $4,778,000 in a year. To provide some support that could be in the home or adult day or overnight in a facility for up to 2 weeks. And the person has to have a written diagnosis of dementia that they're caregiving for. And there's some asset guidelines. And then for the Respite from Me grant, kind of exciting that it's through the Maine Jobs and Recovery Plan. $2,000 go to caregivers. They must show proof of some economic hardship from COVID-19, and they can be and not be receiving main care funds currently. And they can use it towards respite care or transportation, but also self-care for the caregiver. And so that's kind of a neat addition, that this money can be used for more things for the caregiver. And it is not depending on a person's immigration status and or income or assets. So that's kind of exciting also. And they do not have to have a dementia diagnosis. So it could be caregiving for somebody. And also it could be kinship grandparents caregiving for younger children. So that's kind of neat with that expansion. And I see that also Anne Sullivan is on the call. And so Anna Sullivan worked for years at Southern Maine Agency on Aging and did a lot of work with the Savvy Caregiver program. And so thank you so much, Anne. And also we continue to offer that program in Southern Maine. So we're excited to offer that support. And we're working on a memory cafe again. So that's exciting too. And I just wanted to, I saw that James was here. I didn't know if there's James Moorhead at Odes. All those respite programs are administered through Office of Aging and Disability. So if there's anything that he wanted to add in about the respite programs, James, I would welcome it. Or Lori or Robin, if there's something that anybody wanted to add respite wise.
I would just add for respite for me, we are seeking many caregivers. We have $4.5 million for the grants over these next two federal fiscal years. So we have a lot of funds to spend. Please, if you think someone is or may be eligible, please have them contact their local area agency on aging. We want to spend these funds. So.
Thank you.
Thanks so much, Meredith. Thanks, James. And Noelle, is there anything that you would like to add now that the other three have given a brief overview?
Which was so very helpful, by the way. A big shout out to the other panelists. Those of you who may not know much about AARP, other than we are an organization that advocate for older adults, we are just that. And we are a national organization with over 38 million members, and we have over 200,000 members right here in Maine. And our primary goal is to advocate on behalf of older adults in the state. And the issues that we're working on right now range from housing issues to utilities and the impact of utilities on older adults, broadband, transportation, and issues that have direct connection and direct impact on livability and one's ability to thrive in a community. But the two in particular that are relevant for today's session are home and community-based services and our advocacy work for paid family medical leave. And that has a direct connection to what we're talking about around caregiving. And we think those are two areas that are very important for us to work on. We think it's a lot of great work gets done in nursing homes, and we support nursing homes, but there's also, in a state like ours, there's a huge significant need for home and community-based services, and we're kind of really advocating for that in a big way. And we will do that this year, both with our state legislators and with our congressional delegates. And on the paid family and medical leave front, we are definitely pushing for Maine to have legislation that will support paid family and medical leave in the state, because we know that there are over 180,000 caregivers in the state of Maine that don't have any form of support. And so they're having to choose between working and having to take care of a loved one. In connection to resources, AARP has, so if you want to learn more about some of the work that we're doing on the advocacy front, particularly connected to paid family and medical leave and home and community-based services, you can email us at this email address that I just put in the chat. And also, if you want any information that I'm sharing today in terms of the resource guide that I'll actually walk you through in just a moment, and also some of the stuff I will highlight from our website, if you need any more information, if you need more copies of this, or need a copy sent to you, please just email us at that email address, and we'll make sure we have something in the mail for you this week or early next week. So going back to resources specifically, ARP puts together and updates this fairly regularly, called if you can see the ARP Family Resource Guide, Caregiver Resource Guide. And it is a pretty, it doesn't have everything there. I'm just with the who's here around the circle. I'm realizing that, not everyone is on here and that some of you should be here. So again, please reach out to us, email us at that email address, because we want to include you in the next version of this resource guide. But we have everything from general resources, health resources, home and community-based resources, financial resources, legal resources, and then a whole range of other resources that we have through our national office, through the research that we do and our partnership with other national organizations, ranging from resources for family caregivers, care for caregivers, specific audience caregivers, and resources for them, housing resources. So there's a whole range of resources in this guide that we put together, and we update this regularly. It's not a entirely comprehensive list, and we know there are gaps in here, and so we'd love to make it more comprehensive. So if you think we should include something in here, reach out to us, like I mentioned already. Having said that, I'm going to share our website very quickly, and this time I'm assuming that I could access the website. Share my screen. I'm gonna try that. And can everyone see my screen? Can someone nod, please?
Yes.
Okay, great. Thank you. So, so this is a really fantastic resource for anyone to go to. One of the things that ARP does, we're not a service provider, like I mentioned earlier, but what we do is we put together resources. We do a lot of research. We invest a lot of money into finding the right data so that we can make a compelling case when we want to advocate for caregiving resources, when we want to advocate for paid family and medical leave, work and save, could be any of the issues that we work on connected to, or issues that matter to older adults. Sometimes there's also resources on our website that we might not be advocating for or working on actively, but we think it's a resource that's important because it's connected to older adults or has an impact on older adults. We have phenomenal resources, but in particular for caregiving, if you just go to aarp.org/caregiving, it's very easy to remember. And after I finish, I will put it in the chat box as well. But we have phenomenal resources here for you to kind of really take advantage of. If you're a partner, if you're looking for research, and if you see something missing on here in terms of research and data, and you really are curious about it, reach out to us, please, because as a partner, as a caregiver, our goal is to kind of make sure you have as much information as possible. So if there's something missing here, it's very likely we can find a way to get that information for you. And if we don't, it's possible. And again, I cannot promise this 100%, but more likely than not, we can actually work on putting that data together. Maybe not immediately, but we can start working on it so that we can put that comprehensive data set that will be helpful to you and other caregivers and partners and organizations that provide services to caregivers or for caregiving over the next year or two. But we will get to it. It's because our goal is to get as much comprehensive information together as possible for our partners and for other caregivers. So I'm not going to walk you through this whole web page extensively, but just kind of scroll through it. And there ranges from, a whole bunch of stuff from medical stuff to financial, legal, community, local resources, nursing homes, care at home, across the board. So please feel free to kind of check this out when you get a chance. And then if you also want to work with us and want to work on caregiving issues and be an advocate as a caregiver or on behalf of other caregivers, please reach out to us, and we'd love to have you volunteer with us as one of our volunteer advocates. I can see Jessica Simpson, who's here, who's one of our star advocates. She's also a scholar with UNE, a lifelong scholar. If I'm am I right? Is it lifelong scholar or the scholar through UNE program? But
Legacy
anyway,
scholar.
the legacy scholar. That's right. Thank you, Jessica. And you know, and most of the work that we do is we're able to get done because of the volunteers we have, like Jessica and others, who really do a phenomenal job at advocating on their own behalf and other older adults in the state. And so this is just a quick plug around that. So if you're interested in caregiving, want to do more work, want to do some advocacy work, please reach out to us. That is also resource available. So thank you. And I'm going to stop sharing my screen. That's about it.
Oh, thank you so much, Noel, and thank you to all 4 of the roundtable participants. I only wish that we were in a room together and there was a roundtable. But I wanted to just invite everybody to ask questions, and there are 3 questions that have been asked already. One question that I have is just, can you explain again the criteria for the respite funding you mentioned that you're looking for caregivers for? So that program is called Respite for Me. And like James said, there is a lot of available funding right now to do up to $2,000 in reimbursement for people who are currently caregiving and need an additional assistance from the state. And you do need to be able to verify that you had some impact of COVID-19 on your financial situation. So that's an important criteria. And also that you are not currently on another state-funded program. So those are 2 important criteria to know. But James also put a FAQ document into the chat. So if you have additional questions, that's a great place to look. There was also a question closer to the beginning asked around how difficult is it for a family member or caregiver to find a suitable placement once they can no longer physically or emotionally care for the person at home. I have a friend who had to reach crisis before they were able to have their spouse placed. Really good question. Meredith, do you want to start?
Well, we were just talking about that this morning in community services. That, you know, unfortunately, it's very difficult conversations for families to be having, and people will think about it maybe if somebody's hospitalized, and then maybe their only option is going to be the placement that's available from the hospital that the family didn't get to select. And so we're just trying to encourage people as early as possible to be thinking about what it's difficult to think about what future needs there might be, but to think about how the funding is going to come. And so I didn't know if Robin and Lori wanted to add something to from our discussion this morning even.
I think that's exactly right, Meredith. You know, planning ahead is crucial, getting people on waiting lists, understanding how the funding works. And we're certainly happy to help and talk with care partners about that.
And also somewhat related, another question about the cost of private pay for clients. So the cost of private pay quality dementia care facilities is outrageous if needed long-term. What do people do who don't have finances? What is available so people don't go broke at end-of-life care? Lori, do you want to talk a little bit about this?
Sure. Another great question, tough question. So that again is where the planning comes in. There is a provision in the Maine law that allows a community spouse, so the caregiving spouse to staying in the community to keep a percentage of the joint assets, so they have something to live on going forward. We do encourage people to sit down with an elder law attorney to do some financial planning. If one spouse may need care and the other will still be at home, so that that can be figured out before the placement is needed.
And Kimberly, Kim, and Jill, I just wanted to also invite if there's anything else that you wanted to add. And Meredith, did you have something else?
I was just thinking about what Lori was talking about. A lot of people call and ask about our state recovery. So we definitely, encourage people. We tell them what we know, but we also encourage people to talk to LSC and to other organizations that could help if somebody is on long-term care, main care, or the waiver program. There will be a state recovery. And so that's the question that a lot of people ask. And we're also talking today about how a lot of people ask about questions when somebody's coming to Maine, moving from another state to try to access services, and if they're trying to access Maine care. So there's some things about timing when you fill out the application and how long it'll be viable for and that kind of thing, and when the beds will be available. So all things that we try to talk to caregivers about. So
And
go ahead, Kim's.
And though I mentioned earlier, we're not a service provider. One thing we do ask and we emphasize again and again is to start early, start this planning early. And Lori mentioned that as well. I just want to reiterate that whether it has to do with caregiving planning, whether it has to do with retirement planning, we really are encouraging people to kind of start soon, and to kind of not wait till it's the time when they really need that service or need that, program. I think they can start at least 10 years before, 10 to 12 or 15, even 15 years before that. That actually is a great time to start planning.
And I see we've got a bunch more questions coming in from Terza. I hope I'm pronouncing your name correctly. And I also just wanted to encourage, if anybody else has resources or information or something that you want to make sure that this group is aware of when it comes to caregiver resources, you're welcome to go off of mute and just let us know what that is, or use the icon to raise your hand. We want to know, again, what else is available that we should know about. Meredith, would you be willing to answer some of Terza's questions here? So one is, where can I get information on Maine care, and how do I figure out if my person will qualify without applying, thinking about long-term planning? And also transportation services available in Cumberland County, specifically in Windham.
Well, Meredith had asked me to to respond. So with Maine Care, feel free to give us a call. We can talk in a little bit more detail about some of those, the assets and that kind of thing. Happy to do that. We do have a list of transportation resources as well, that we can send out. Transportation is tough. It's hard to find, but there are some other resources and like regional independent transportation network and some other things like that. So again, don't hesitate to reach out to us. We do have that list. It's also on our website. And then I don't remember what else.
Thanks.
Oh,
yeah, do you see the other ones?
Well, then it was just financial planning, the elder law attorney, I think. And we do have a list of elder law attorneys. There are some free or reduced cost attorneys services on there as well.
And could I add that, so long-term care, Maine care requires that the person themselves have no more than $10,000 in liquid assets. With a spouse, spouses, there can be some transferring, but that you'd want to do with an elder care attorney, somebody who really understands those Maine care laws. But other than that, if it's a single person, they have to be very careful about giving money away to kids or grandkids, or that. There's a lot of laws around that. So, we would certainly try to help people with some information, but they may need some legal advice as well, because, you don't want to do it the wrong way and then find you're not eligible when you come to apply.
Absolutely, Lori. And I think some of these questions too about navigating and understanding the resources and who can really help me. Again, you know, our caregiver support team at Southern Maine Agency on Aging is here to help explain those different resources that are available. And as your local area agency on aging, we do remain really unbiased. So we're going to give you all of those options, but to some of your questions, Terza, it's really going to be up to you to make some of those decisions. So again, the earlier that planning starts, usually the better. And G, I saw that you had your hand up. Welcome, G.
Yes, hi everyone. I am the manager of Maine Senior Farm Share, and that is a seasonal program. It runs from April to, you can sign up from April to September, and you can use the share, there we go, from as soon as the farm you're signed up with has food to buy all the way through November, the end of November. I will be working with all the area agencies on aging to publicize when enrollment for 2023 starts, but I wanted to raise my hand because we allow proxies. So even if you're caring for someone that can't actually get to the farm, or you're cooking for that person or whatever, or if clients of yours are looking for food and food insecurity based resources, you can sign up for Senior Farm Share and buy on behalf of someone as long as they are income eligible. And I also, some folks may already know this, but I also wanted to say that even if the person you're caregiving is SNAP eligible, you can enable, you can have people shop with your SNAP benefits that aren't you. So just want to share those things, and I'll put my email in the chat too.
Great. Thank you so much, G. It's so wonderful again to come together so that we can hear about what is available and see what those questions are. And Ashley, it looks like you have an update as well.
Yes, I just wanted to put a plug in there in case folks were not aware that, oh, and by the way, I'm Ashley. I'm the nutrition manager at SMA. Happy to be here. So with the Meals on Wheels program, live-in spouses or caregivers, as long as the care recipient meets the eligibility criteria for Meals on Wheels, that live-in care partner can also receive Meals on Wheels if it reduces the caregiver burden. So just want to make sure everybody was aware.
Definitely. Thank you, Ashley. And as you're perusing the Southern Maine Agency on Aging website or the AARP Family Caregiver resource page, you know, like Noelle said, also sign up for our newsletter, because that's a chance, again, where you'll just get more regular updates from these organizations around what is available. But there was a question about day activities for caregivers and the person that they are serving. So we do have an adult day program here in Biddeford that's available for people with dementia, and it's great respite for the caregivers, and we're able to offer some activities as well as support groups. So that's a great item to check out. But Jill might have some examples of online resources that are available for caregivers, or others on the call. If you know of other examples, please do pipe up. And I'm aware also of time, because we have just a few more minutes, and then we're going to move to the networking portion of today's exchange event, which is a chance for you to connect more directly with a group of 8 to 10 individuals and just share, again, challenges or opportunities that you're seeing system-wide. But any other questions or updates related to caregivers, please feel free to go off mute.
Megan, I'll just mention from Hospice of Southern Maine, if you are caring for someone on hospice, we do have the Gosnell House that offers respite care for your loved one or the person you're caring for if you need to go away and have a break, and it's usually about 7 days.
So I was the one that asked the question, and my question was more around, I'm the caregiver for my husband, and I was more interested in, are there activities that he and I could do with other people who may have dementia? I haven't been able to find any. So that was really what my question was more about. I am familiar about the Biddeford program, which looks really good, but we're not there at that right now because I'm his sole caregiver. So I was just curious if people had places where you could go and be with other people.
I think that's a great, great piece of feedback. I can see some wheels are turning for my colleagues around what resources we might be able to find, and or if we could maybe look at doing some joint programming. So I think that's a great suggestion that we want to take back. Thank you. Yeah.
And also, I mentioned just briefly in the chat about the memory cafe that, you know, your husband doesn't have to be coming to the adult day center to participate in that it's just kind of, we had music and I had a meal. And so that's the caregivers and their loved ones that have dementia, they're just interacting, and we're just kind of working on it a little bit more. We heard that it takes a while to get it up and running. And so we're trying to do our best to have that programming, but that's kind of what it's designed for, that you could be together. Because the adult day center model is mostly the caregiver gets respite while the person with dementia stays at the adult day center, but this is for both.
I did see that one.
Yes.
I have been researching. That's why I'm asking the question. That was the only thing I saw.
Yes, I think there was several more in Southern Maine before the pandemic, actually, of memory cafes. Other organizations had them, and I just haven't seen them come back. So it would be really neat for other organizations to bring this type of programming back. So I'd love to see you there.
There was something in the chat early on about the Alzheimer's Association and the chess club.
Yes, that is for, I'm not as familiar with that, and maybe Tom, if you're here, you know, feel free to jump in, but essentially it's for people living with dementia kind of in your early onset. I'll turn it over to you. You know more details than I.
Sure. It's nice to be with all of you this afternoon. So a volunteer for the Alzheimer's Association who is a neurologist approached Amy Angelo about forming a chess club for persons with early to maybe mild, moderate dementia and their family caregivers. And so Amy was looking for a host site, and I saw an opportunity for this to be intergenerational with UNE students. So we're doing a 6-session pilot. It'll be on the Portland campus in the building that I'm in on Forest Avenue, 1075 Forest, the 2nd and 4th Saturday mornings of March, April, and May. And in the post in the chat, there's a promo video we put together to kind of show what this is all about. So this is kind of a reboot for some early stage programming for the chapter, but it's also a great opportunity for student learning. So I'm really thrilled to be a part of it. And anyone who wants to know more can either email me, I guess Jill, or Amy Angelo.
Thanks so much, Tom. And thank you to all of the participants today in our roundtable discussion. It's clear that this is probably one of many conversations to come, and it has helped inform us as well about what might be needed in our community. So please continue to ask these questions and provide feedback. And as we shared at the beginning, today's session is being recorded, and everything that is being put in the chat, whether it's a resource or a question or an event coming up, we will include that in the follow-up email afterwards. So know that that's coming. And again, just wanted to say thank you so much to all of the participants today. And we're going to move to our networking part of today's meeting. So if you are going to stay on and join us for that part, what we will do is we'll have 2 brief breakout sessions, about 10 minutes each, and it's a chance to connect with your colleagues. And we have 2 different discussion points today, again, related to caregivers. And this is, again, a chance for us to capture information, resources, and feedback around what is working and what's not working. And we wanted to also just take a moment to capture and know before we move into our networking groups who is here in the room today. So I know everybody has put their name and affiliation into the chat, but we're also just going to launch a really quick poll. And we just want to know, are you here today on behalf of an organization or person who serves the entire state, just York County, Cumberland County, both counties? If you don't mind just taking a moment to answer these two questions. Then we're also curious, what are the current challenges that your clients are facing? So take a moment to just fill out our poll before we go into the breakout groups. This helps inform what folks are most interested in talking about, what challenges you're seeing. And I'll let you know that many folks right now are representing both Cumberland and York counties. And I think every single challenge that is listed on that list is being checked. So we know that our clients and our caregivers are facing some really extreme challenges today. And that's, again, why we're here, to know and understand what's available and what more we can do to support one another and our organizations. And it looks like we have almost 80% participation for the poll. So if there's anything else you want to add in there, now's your chance. And then I think we can share the results of this poll just so you can all see. Can everyone see those results now? Yep. So significant challenges facing our clients right now: transportation, housing, social isolation, and loneliness. In-home care was mentioned in the chat around how to walk through the options available. And the truth is, yes, there are extreme wait lists right now, and we know that there's more that can be done to align our services and information. And then before we go into breakout groups, Bistra, is it possible to just share what that live question is for everyone? Great. So for our first breakout group today, the question is, what resources does your organization have, or what do you need to provide direct or wraparound services to clients? So again, we've heard from many of you already around what you need as caregivers or as organizations, but this will be our breakout topic. And if we're ready, Bistra, I think we can go ahead and open up those breakout rooms. Again, we'll just do a couple small sessions today so you get a chance to connect.
I didn't get a breakout room prompt. Is this a breakout room as well?
Thanks for letting us know.
I came in late. I think that might be why.
Sometimes we have to send an additional.
Oh, there we go.
Did you get it now? Okay. Great question.
Hi.
Maybe I'll pause the recording for a second. The above. Okay, I think all the breakout rooms are coming to a close, but I think your group came back first, Robin.
Yeah, I think so.
Yeah.
They were kind of weird how it was really slow. Like I was the only one in the breakout session first, and then Kathy came in, and it was kind of just like, it was really slow. I don't know why.
It might be the way that I was assigning groups randomly. It might have been just purely manual thing. Nothing to do with the people who joined.
Secrets out. Oh, Kathy, we can't hear you.
Are you doing your little debrief of the meeting now, or oh, is everybody coming?
Exactly.
Okay.
Yep. Yep.
I
Everybody's coming back.
Oh, okay.
Yes.
I thought maybe I wasn't supposed to be here.
No, definitely. Welcome back, everyone. And I'm excited to know how it went in your breakout groups and if there were other needs or resources identified. I think, as I was saying in my small breakout group, if anything today has really highlighted just how much more work we have to do on behalf of our caregivers who need support right now. So thank you for that feedback and for informing us as a community and as an organization. But I wanted to just open it up for a couple of minutes. Are there any reflections, information, questions, or feedback that you want to share from your breakout group?
In our group, Megan, we were talking about the financial need for caregiver assistance, or that people can't afford it easily. And I was thinking, we were asking, why don't people know about the assistance programs that have come available? How are they communicated? Do you know?
Yeah, it's a great point, Kim and Kimberly. And I would say for the very new one, the Respite for Me grants, that was only announced by the governor's office in the fall. So I would say, it's good to know we're still at the very beginning of that. And so there's an opportunity to continue to broadcast that message. And the state did hire and is working with a marketing firm to help promote it. But I do believe, honestly, that a lot of it is still word of mouth, which is why we've got to do both and, right? Have that larger broadcast through the marketing firm, but also through word of mouth through all of you. But then the other program, there hasn't been a large broadcasted message besides just through the local area agencies on aging. So thank you for highlighting that. We need to do more.
Do you know if there are pamphlets or flyers available that we can share with social work teams?
Absolutely. And I think that would be a great resource to also include in our follow-up email. And I'll again just drop the link into the chat, which has kind of the most up-to-date information. Yeah,
Wonderful.
great.
Thank you.
Yeah, thank you.
And
Other
also,
reflections? Yeah, Lacey.
I wonder if it's because it seems to me that it's hard to find one individual that wouldn't already be involved in something else that would discount them from being in the respite program. Like, for example, I was a care coordinator with Seniors Plus, and it's my understanding that no one that we served through main care was eligible for those funds, but those were exactly the people that needed them. So it's hard to understand where a human would fit into the categories without being shut out of the categories.
Megan, can I could take that one. We've opened, I believe, around 50 people already for the Respite for Me. And probably more than 30 have actually screened in for the original Caregiver Respite, which is about twice as many as we had before. So I hear what you're saying, but I think we're getting people on board as quickly as we can, and there are people that are qualifying. But you're right that if people are accessing other state funded services, they cannot. I mean, that was a criteria that the state gave us. We have no leeway on that. So.
And if it's working really well, then that person is getting help, right? Like if they're on a state funded program, they have a plan of care and they actually have staffing, then they're hopefully getting some support in the home. If that's kind of.
That's a really good point, because we're not part of the state. We don't get any of that. So I have found it less stuffed. Whereas if I didn't have anything, I would get more for my husband, which I find very ironic. We're trying to do everything at home so that we don't have to rely on the state, but I find that there's less for those of us that are right in the middle.
Mm-hmm. And things like, how do people find out? Just, I wasn't sure, Kimberly, if you were talking about respite programs or other programs also, because I think about, I was looking at Bill with Medicare counseling and how people don't know what's included in Medicare. Like, how is somebody supposed to know that Medicare doesn't cover in-home care, right? That it's covered skilled care after somebody gets out of the hospital. But how does somebody, when they age into Medicare, find out about these things about what Medicare actually covers? And of course, you know, at Smile, we do Medicare counseling. But where does that information come from? Like, who does somebody know? Social Security refers a lot of people to us because a lot of people when they retire get Social Security. And so then we just need to be spreading the word about what people are eligible for and what services are out there, in addition to those respite programs, but like the state funded care, just general.
And Lacey, I think that's good feedback again around the program and the eligibility. And like Lori said, you know, those requirements have been set. And because we're at, again, the beginning of this rollout, there's also the opportunity to continue to share feedback around, you know, we're hearing this would be helpful for additional folks. So if there's anything we can do to advocate on that front, we want to do that too. So thanks for sharing that. Well, it's 1:16 and I'm just cognizant that we've been sitting in a Zoom room for an hour and 16 minutes. So I think what we might do is, if you want to stay on and continue to share and connect with colleagues, you're welcome to. But otherwise, we'll go ahead and just say that this concludes our exchange meeting, which was all about caregiver resources and what is or is not available. So thank you for sharing what some of those needs are, which will help inform programming and also anything that we can do to continue to bring providers around these really important issues and topics is so relevant. So thank you to everybody who joined today. And again, we'll send a follow-up email that includes information from the chat and what was shared here and a recording. So you're welcome to forward that along to folks as well. But just thank you so much. And thank you for your continued efforts on behalf of older adults and caregivers in our community. We just really appreciate it. Thanks, everyone.
Thank you. Have a great day, everyone. Bye.
Care.
So I was thinking of saving the chat, but I forget how to do that. But will everything, you're going to include a list of everyone who was here? Or should I try to save it?
Yeah, great question. Definitely try to save it. So the best way to do that is if you're in the chat, there's 3 dots at the bottom.
Oh, yeah.
Yep. And then you can do save chat.
Got it. Thank you.
Yeah, that'll help with participants. But if somebody put in an event or an update, we'll try to include that in the.
Perfect. All right. Thank you so much.
Yeah. Thank you, Kathy.
Okay. Bye-bye. Nice to see you, Meredith. Bye.
Lori, I'm so glad you were there to answer all those questions.
Oh, well, I hope I didn't overstep, but
No.
I asked Lori and Robin if they would answer questions.
I was so smart. I knew you were probably working